Hi everyone, this is Dr. Mamta Dighe. I'm the director of Xenith Advanced Fertility Center. We are based in Pune at two locations, Koregaon Park as well as Wakad. So today I'm going to be talking to you about tubal factor infertility. Now, what are fallopian tubes? These two tiny to say tubular structures are present at two sides of the uterus in the female reproductive tract. Often overlooked because we always try to give importance to the eggs and the sperms, the uterus, because it is carrying the pregnancy, but we forget that these two tiny tubular structures are the conduit between the egg and the sperm. This is because the tubes connect the uterus to, it's not really connecting it to the ovary, but the tubes are very close to the ovary and they pick up the egg that is released from the ovary during ovulation. And this egg is transported from the lateral end of the tube towards the uterus. At the same time, when intercourse happens and the sperms are deposited in the vagina, the sperms travel up by themselves as they are motile and they enter into the fallopian tube from its medial aspect. And it is in the fallopian tube that the egg and the sperm meet. The egg is fertilized by the sperm, an embryo is formed, and a very important fact is that the first few days that the embryo is nourished happens in the tube. So the secretions in the tube, the environment in the tube, all are important factors for this embryo, this early embryo, not only to get formed, but also to get its nourishment till it reaches a stage called the blastocyst stage, when this embryo actually enters the uterus and gets implanted into the uterus. Now just imagine a condition where one or both the tubes are either diseased, blocked, or filled with water and are non-communicating. What is happening here is that the egg and the sperm will find it very difficult to come together, and hence formation of an embryo itself gets hindered. Even in the rare occasion that the embryo is formed, this embryo can get trapped in the tube itself, resulting in a tubal or an tubal-ectopic pregnancy. And hence, assessing the tubes is a very important part of assessment of the female part of infertility as we assess the eggs and the uterus. Now, many a times, if there is a history of any previous pelvic disease, pelvic infection, previous surgery, past history of tuberculosis, which we see very often in a country like India, all these factors can sometimes point towards a suspicion that there could be a tubal factor infertility. And it is very important to elicit the history from the woman whenever the case history is being taken. These tubes need then to be investigated. The two most important ways that we look at or investigate tubal factor infertility are, one is HSG or a hysterosalpingography, and the second is called a laparoscopy. HSG is an X-ray that is taken after pushing dye into the tube, and it is expected that the dye will enter into the uterus, spill out of the tube, and that is when the X-ray is taken. Now, one very important thing that we need to understand is that the HSG usually tells us about the patency of the tube. It is very difficult to ascertain whether a tube is diseased based on an HSG. Of course, there are telltale signs such as, the tube will look swollen, it can look beaded. There are many kind of signs that we look at, but most of the time, the HSG will tell us whether the tube is open or blocked. There are some other tests, simple tests like sonosalpingography or a high cosi, etc., but the two most common ones are the ones that I have just mentioned. What about laparoscopy? Now, what is laparoscopy? We will definitely talk about, or we probably have already talked about laparoscopy in detail in some of our other videos. But laparoscopy is a small keyhole surgery. Because this is a small keyhole surgery or a surgical process, we are here putting a small scope, a telescope with a camera inside the abdomen. So what happens when you do that is that you can actually look at the complete tube in its entirety. You can look at the ovaries, you can look at the uterus, you can look at the other pelvic structures, and here, in addition to patency, you can also understand whether the tube is diseased, whether it is adherent, whether it is filled with water, and if there is a blockage in the tube. The good part is that you can even try and do a tubal cannulation, which may help to open up the blockage. At the same time, you can also take care of the adhesions and any other problems that you see during the same sitting. All in all, tubes are a very important part which should not be overlooked in the process of an infertility workup. To watch some more videos, definitely do follow us on our Twitter, Facebook, YouTube handles. I hope this video has helped you understand a little bit about tubal infertility. If you have any more questions, please do write to us. We love to hear from you, and we'll keep bringing more videos so that you can have more and more information in order to understand your journey towards your parenthood. Thank you.